Well, hello there. My name is Edson Ceballos, and I'm going to talk about anxiety in sports. And the presentation of our team is Charlie Cantu, and myself. And he will talk about the arousal, and I will talk about the anxiety in sports. Well, first of all, I'm going to talk about the definition of anxiety related with sports. Dr. Roham Jones says that the anxiety in sports is the result of an interaction between the individual and the environment. It's an emotional response to the demands placed upon the individual by the environment. Like the player must feel the pressure of the environment of sport, like the coaches, the other athletes that he will or she will compete against, and the public. The anxiety in sports is most common in competitive sports environments, like in the professional level or also in college or like high school, because those athletes will have pressure in the college level about they want to perform perform to achieve a goal that is play in the professional league, and the professional players they need to have a good performance to maintain their jobs. There are two types of stress: the positive and the negative stress. The positive stress is considered to be an important element of an athlete's preparation, heightening the senses and leading to a feeling of being psyched up both physically and mentally. Well, the positive stress is is an example like an athlete have a wall of stress, and he will break that wall and overcome that stress to make a better performance on that event. And the other thing is the negative stress. The negative stress can promote feelings of self-doubt, directly affecting an athlete's ability to cope with regular stresses of a competitive environment, ultimately leading to a drop in performance. The other side is that in the wall of stress, that athlete cannot break that wall, so he will feel like his performance is going to be lower than usual because all the stress that he or she have. The symptoms of anxiety. Cognitive symptoms relate to thought processes including fear, indecision, poor concentration, loss of confidence, and defeatist self-talk. The physical symptoms include muscular tension, clammy hands and feet, increased heart rate, sweating, and butterflies in the stomach. The behavioral symptoms relate to patterns of behavior, including inhibited posture, fingernail beating, avoidance of eye contact, and uncharacteristic displays of introvert or extrovert behavior. Those are many causes, but the principal cause is the when an athlete perceives what is being asked of him to be beyond his capabilities. He feels that what the coach or the media expect of him is a lot higher that he he thinks of that his capabilities will allow him to make it. So he will feel like he's not ready for that. So it could be two two answers of that, two examples. The first one is the positive stress, so he can break that wall of stress and performance have a better performance that he expect, or negative stress that he will decrease his performance. And also the perception of his abilities may be based on a previous performance. That means that if in the last game or race he or she did a bad job, so the athlete will feel like he's not ready, he's not good enough to make that job. And the effects. The ownership, that means that the athlete will perform less than usual. The burnout, that the athlete will feel a lot of pressure of the teammates, coaches, and media. So he or she will drop, like have a break of the sport, like a year, and he will come back with his mind clear. And the ultimate effect is the leave sports completely. So he or she will drop in the sports and he will not come back later. He will think that he's not good enough to participate in that sport anymore. So he will quit to the sport that he's practicing and thinks of and think of making other things. And that will be all of anxiety. Thanks.